So today we're going to be looking at POTS, or postural orthostatic tachycardia syndrome. So what is POTS? POTS is an orthostatic intolerance condition, so regulation with blood pressure. It's a chronic illness that ranges in severity. You could have some symptoms or you can be completely debilitated by the symptoms. A lot of what happens is not enough of blood returns to the heart and the head. It affects a lot of people actually, and roughly 1 to 3 million Americans are affected. It affects women more likely than men with a 5-to-1 ratio, and generally women under the age of 35. So some of the symptoms of POTS are lightheaded dizziness, which can lead to fainting or syncope, blurred vision, heart palpitations, gastrointestinal symptoms, weakness, sleep disorders, and cold and pain in the extremities. So what causes POTS? POTS is not well understood, and there are many conditions that are suspected to play a role in the development of POTS. So the decreased amount of blood returned to the heart or the brain after moving into a standing position. So if one were to go from sitting to standing, laying to standing down too quickly, it can cause some of the symptoms that were just discussed. Impaired function of certain nerves, changes in heart and blood vessel function, abnormal regulation of blood pressure, smaller heart size can actually impact this and cause some of the symptoms, decreased blood volume and decreased stroke volume and tachycardic rate. So based on those possible causes, there's different types of POTS. There's neuropathic, which is caused by nerve fibers that are damaged that regulate blood pressure, will regulate the blood vessels constriction in the lower body and the torso, which causes the blood pooling and people to feel faint and possibly pass out. And then there's hyperandrogenic, which is elevated levels of norepinephrine. There's hypovolemic, which is low levels of blood, and secondary, where conditions such as diabetes, Lyme disease, and various autoimmune diseases such as lupus cause autonomic apathy. So what are some short-term relief for these symptoms? You can do, if someone were to stand up and felt these symptoms come on, one of the most immediate things that you would want to do is sit or lay down to reduce those symptoms. And then day-to-day life, you can wear pressure garments that can help with circulation and prevent blood pooling in the lower extremities. And then on this graph here, some of the ones listed, squeezing a rubber ball to help get blood circulating, anything to get the blood circulating again or help with that is recommended. So crossing if you're standing and you can't sit down, crossing your legs and tensing your muscles. There's another thing that you can do. It's called cardiopulmonary resuscitation, which is where someone were to cough violently to help either stop or fix like the heart rate and get blood flowing again. So a diagnosis of POTS can actually be extremely difficult. In this graph over here, it shows that the majority of people have to see 2 to 4 or 5 to 7 doctors before they get an actual diagnosis, because it can be mistaken for a lot of things. And sometimes the symptoms aren't always, they can come and go, and you can have periods of remission. So because causes and symptoms can vary person to person, it can be difficult to diagnose. Some of the diagnostic methods included are a regular physical exam, blood work, standing tests. Someone with bad symptoms of POTS typically can't stand for longer than 1 minute without feeling faint or possibly passing out, because all the blood just stays in their legs and they can't adequately circulate blood. And there's a tilt table test, which is in the diagram over here, that it simulates going from a laying to standing position, where they'd have you hooked up to most likely an ECG and blood pressure cuffs, where they would monitor your symptoms. And because of the blood pooling in the legs, the tachycardic symptoms is your heart just trying to compensate for the lack of blood that is returning to the heart and to the brain. And they do nerve testing to see if you possibly have the damaged nerves that would help with the blood vessels, or you could get an MRI. So sodium and POTS. Sodium and salt intake is one of the most influential treatments for those with POTS and most important. Increased sodium intake through food or through salt tablets is a common prescription. And increased salt can help raise and stabilize blood pressure, which will help minimize syncope. Other treatment methods. Because of the many possible causes, there's no one treatment that works for everyone, and it can take a long while to figure out what treatment plan works best for what individual. Some of the common medications are beta blockers because it reduces heart rate and the tachycardic events that follow the drop in blood pressure and pooling blood in the limbs. You could do corticosteroids, which helps the body retain salt, which then helps retain water and help with blood pressure. And then you can take alpha blockers, which help constrict the blood vessels to prevent blood pooling in the lower limbs. And then a lot of lifestyle changes are also used. So increased salt take, as I talked about before, increased fluid intake, and exercise. So why is exercise important for individuals with POTS? It is one of, and if not the most important treatment for POTS. Cardiac deconditioning can amplify symptoms and plays a role in physical disability associated with POTS. Although difficult, it breaks the cycle of exercise intolerance and cardiac conditioning. It strengthens muscles and blood vessels to help circulate blood better. So for my case study, I looked at or created. So a female who's 35 years old, she's white, and she has hyperandrogenic POTS. She has moderate to severe levels of symptoms, and she takes beta blockers and salt tablets. Her medical history, she's diagnosed with POTS 5 years ago and struggles with regulation of symptoms. She has lifelong exercise intolerance and a sedentary lifestyle because of that, because she cannot stand for long periods of time or do most day-to-day activities. She's been on those medications since her diagnosis, and she has no other conditions, no other known conditions. So conversation points that would be had with her be the informed consent and medical clearance. Because heart conditions can actually go alongside with POTS, you'd want to get her cleared by a physician to make sure that it's okay to exercise. Go over her medical history and her expectations and goals, and make sure that there is an open communication about symptom status. Because I wouldn't ask what kind of exercises that she likes, because of her severity of symptoms. As I'll get into it, there's not much that she can do. More of expectations of what the beginning of the exercise prescription would look like and how it would progress. So exercise testing. Exercise testing should only be done in a seated position to decrease the symptoms of POTS. That's how it is. That's how it should be done for most individuals with moderate to severe. Some people with light symptoms may be able to do more than those with a larger amount of symptoms. So I would do a 6-minute recumbent cycling instead of a 6-minute walk, because a 6-minute walk would not be advised, because it could bring on symptoms and possibly cause the client stress and make things very difficult. For resistance, I would do a 10 rep max for seated machines. And for flexibility, do a sit and reach and shoulder stretch test in the seated position. So exercise prescription. For her aerobic prescription, I said 3 to 4 times a week. Oh, and also these are all based off of studies done by CHOP and various other places that gave me detailed prescriptions. So 3 to 4 times a week, and she should have an RPE of about 13 to 15. Because of her state and because of the beta blockers, you can't typically go off of heart rate. So it'll have to be off of the RPE scale. So for intensity, 13 to 15 on the RPE scale. For time, it should be about 25 to 30 minutes. And the type, it should be swimming, recumbent bike, or rowing. And as I said here, so for the first 3 months, it is critical that the exercise is performed in a seating or horizontal position to reduce and limit the POTS symptoms that may come about. And starting at month 4, you can progress to upright stationary cycle. And month 5 can incorporate treadmill and elliptical, depending on how the client is doing and progressing. And recovery workouts are encouraged. So on days off, doing light work if they can around the house, but doing like some seated leg exercises. So for resistance, it should be only 1 to 2 days a week in the beginning with an RPE of around 10 to 13, and it should be roughly 30 minutes per session. And they were advised to do 2 sets of 10 of the following: seated leg press, leg curl, leg extension, seated calf raise, chest press, and seated row. And they're also encouraged to do abdominal exercises such as crunch, back extensions, planks, and plank variations. So as I put here, the focus is primarily on the lower body because that's where all the blood pools and that's where you want to really strengthen. And it just helps with blood flow. Although they do have some upper body exercises in there, it is not the prime goal to strengthen those in the beginning at least. So for flexibility, I said 2 to 3 times per week at a low intensity where you stretch to the point of tension, 10 to 15 minutes per session, and do only seated static stretches. Special considerations for someone with POTS. In early stages of exercise programs, symptoms need to be monitored very closely. When getting up from a seated position, do so very slowly and check in with the client throughout the exercise just to monitor symptoms. And if someone were to start getting symptoms while exercising, you would stop immediately. And for medications, because she's on a beta blocker, she'll have a lower heart rate, so you can't use age predicted maxes for her aerobic measuring. And also because of the beta blockers and just general symptoms, you'd want to do an extended cool down. So in conclusion, POTS can be an incredibly debilitating chronic illness, which requires a lot of special considerations. If working with someone with POTS, it is extremely important to know about the symptoms and what can trigger them, since they are more likely to occur when exercising. Exercise is one of the most important treatment methods for POTS, and although prescriptions may start slow, everything helps. And the goal is just to get them more functional in life, especially this woman, because she has severe symptoms. There's my bibliography, and we're all done.